Many parents are unaware of what SIDS is and how to protect their sons and daughters from it. Every year, approximately 2,500 babies will die from SIDS. SIDS is a mystery because no one can really find out what is causing these babies to die. SIDS is short for sudden infant death syndrome and was originally first defined in 1969. SIDS also can be known as cot death or crib death. SIDS is an unexplained death of a child who is under the age of 1, and it usually occurs to a child when they are sleeping. In the 1989 journal, Theories of Cardiovascular Causes in Sudden Infant Death Syndrome, Warren G. Gunforth states the peak rate for SIDS is between the second and third month of life. The cause, no one really knows, as I stated before, what causes SIDS, but some theories behind the causes scientists are beginning to kind of find out. David T. Megg and Mariah Donner quote J.L. Emery in an article from the 2009 International Journal of Pediatrics, a unifying theory for SIDS, that some causes could be a 3 interrelated causal spheres of influence model, which include a subclinical tissue damage, deficiency in the postnatal development of reflexes and responses, and environmental factors. J.J. Flingo and H.C. Kidney were also quoted by Megg and Donner stating SIDS could also be caused by a triple risk model, in which this requires the infant to be either at a vulnerable state, a critical development period, or having environmental stressors for the infant to die of SIDS. Some examples of environmental stressors would be sleeping on the stomach or side, being overheated when they sleep, or having exposure to tobacco. Now, with these theories come ways to prevent these theories from coming true. One of the most effective is to have the child of less than 1 year, sleep on their back. Another is to have the crib or bassinet close to the parent, so they're able to go and check up on the baby regularly and just make sure him or her breathing. Another way is to not allow loose bedding or stuffed animals in the crib or bassinet when the baby is sleeping, because the baby could turn or move around and wind up having their face next to the stuffed animal, or having the blanket come over on their head, which is also why they're not allowed to have bumpers on the crib and the inside of the crib anymore, because the baby could turn to their side when they're sleeping and suffocate because they have their face to the bumper and not be able to breathe. Studies from E.A. Mitchell, P.S. Blair, and M.P. Lahore in the 2006 Pediatrics Journal showed pacifiers recommended to prevent SIDS conclude that it is beneficial for the baby to have a pacifier when they're sleeping rather than not having it, because they have done studies that show that the pacifiers help prevent it because they're stimulating and they're always having the pacifier in their mouth. And when they're not having the pacifier, they'll cry, and that will cause the parents to go and check up on them. Another prevention, James Bickman, Sarah Mascow, and Chris Richard found in a study that breastfeeding can also prevent SIDS because the mother is constantly waking them up at night for the late night feedings, or the baby will be waking up the mother, so the mom will always be checking up on the child and making sure everything's going okay. In conclusion, SIDS is a dangerous and mysterious death for infants because no one can figure out exactly what is causing it. But through these studies and finding out the causes and preventions for SIDS, more and more parents are able to prevent SIDS and save their sons and daughters from this unfortunate death.